Welcome back to Great Day St. Louis. With coronavirus cases still on the rise, there are still so many unanswered questions. I have a few myself, including the current status of it here in our area and what we need to be more mindful of right now. So we called in an expert, as we often do, to answer some of our questions. Please welcome back to the program Dr. Steve Lawrence. He is an infectious disease specialist at Barnes Jewish Hospital, the perfect guy to talk to right now. And I know you're very busy, so thank you for joining us, Doctor.
Yeah, thanks for a chance to talk with you.
I want to ask my question first so that it gets answered. I'm being very selfish here. We're hearing a lot of reports now in the news media about how we're seeing more and more record daily cases reported of COVID-19. My question is, how does that relate to hospitalizations? Is there a correlation between those numbers? Are we still seeing increasing numbers of hospitalizations, or where are we there? Because to me, the hospitalization seems more like what we want to know is in reference to how many people are actually getting sick from COVID-19 and how does that compare to weeks and months past?
Yeah, this is a very important question and something that is a little bit complicated because you look at numbers and it can mean a number of different things. What the increase in cases can reflect, and in our case in Missouri, it does reflect a couple of different realities. One of them is that as you test more, we'll find more because of the fact that, on average, we think there are, for every case that is detected and confirmed, there are between 8 and 10 that go undetected and that we just haven't identified. And usually those are people who aren't as sick. But the more you test, the more you'll find. And this absolutely is true. However, there are also some indicators that in many parts of the country, there is increased spread that is going on, actually more cases occurring that is in addition to, not just related to increased testing. And in our region, we've seen a fair bit of stability over the last month or so. We had a peak in April, and then it has tapered down, but it hasn't gone away. And you mentioned the hospitalizations, and that is a very important number for us to track in our region because it is a relatively stable number. No matter how much testing we do, we still would have a relatively fixed number of hospitalizations that is relative to the amount of transmission or spread in the community. And so when we see the number of people hospitalized go up, that absolutely is an indicator that there's increased transmission in the community. We've got some low-level transmission that has gone on for quite some time, and a little bit of a signal that maybe there's a little bit of an uptick currently.
Good to know. All right, so it's still very important that we wear masks and social distance at this point. I assume you agree with that?
There's nothing more important than that right now, and it will be our reality for the time until we have a widely available and effective vaccine. And this is something that we can't stress enough, because if we as a community continue to follow three major ways to prevent spread, it's avoiding getting together in gatherings. And when that's not possible, staying 6 feet away from everybody else. And when that's not possible in particular, everybody wears a mask. If all of those three things are done throughout this community, we can keep the businesses open, we can keep the spread to a reasonable level for a much longer period of time if we just make sure that we focus on those three things.
That's good to know. Thank you, Dr. Lawrence. Always a pleasure to talk to you. And I sense we'll be checking back with you in the days and weeks and months to come. Best of luck and thank you for your time.
All right, thank you.